This session, we will be discussing applying ethics to nursing informatics. At the end of this session, you will be able to examine the ethical implications of nursing informatics and evaluate professional responsibilities for the ethical use of healthcare informatics technology. The knowledge age is changing healthcare in ways that will not be fully recognized and understood for years. As with any paradigm shift, a new way of viewing the world brings with it some of the enduring values of the precious worldview. Ethical decision-making frameworks will remain constant, but for the context for examining these moral issues and ethical dilemmas will become increasingly complex. The change is paradigmatic, and every expert who addresses this change reminds healthcare professionals of the need to go with the flow of rapid change or be left behind. Ethics is the process of systematically examining varying viewpoints related to the moral questions of right or wrong. Beauchamp and Childress in 1994 refer to ethics as a generic term for various ways of understanding and examining the moral life. Ethical approaches to this examination may be normative, presenting standards of right or good action, descriptive, reporting what people believe and how they act, or explorative, analyzing the concepts and the methods of ethics. Regardless of the theoretical definition, common characteristics regarding ethics are its dialectical, goal-oriented approach to answering questions that have the potential of multiple acceptable answers. Bioethics is defined as the study and formulation of healthcare ethics. Bioethics takes on relevant ethical problems experienced by healthcare providers in the provision of care to individuals and groups. Bioethics is defined as the study and formulation of healthcare ethics. Bioethics emerged in the 1970s as healthcare began to change its focus from a mechanistic approach of treating disease to a more holistic approach of treating people with illnesses. Bioethics takes on relevant ethical problems experienced by healthcare providers in the provision of care to individuals and groups. As technology advances increase, recognition and acknowledgement of rights and needs of individuals and groups receiving this high-tech care also increased. In today's technologically savvy healthcare environment, patients are being prescribed applications, simply known as apps, for their smartphones instead of medications in some clinical practices. Patients' smartphones are being used to interact with them in new ways and to monitor and assess their health in some cases. With apps or add-ons, for example, a provider can see the patient's EKG or electrocardiogram immediately, or the patient can monitor his or her electrocardiogram and send it to the provider as necessary. A sensor attached to the patient's mobile device could monitor blood glucose levels. We are just beginning to realize the vast potential of these mobile devices and the threats they sometimes pose. Google Glass, for example, can take photos and videos without anyone knowing that this is occurring. In the healthcare environment, such a technological advancement can violate patients' privacy and confidentiality. Add these evolving developments to healthcare providers' engagement in social media use with their patients, and it becomes clear that personal and ethical dilemmas abound for nurses in the new uber-connected world. As connectivity has improved owing to emerging technologies, a rapid explosion in the phenomenon known as social media has occurred. Social media are defined as a group of internet-based applications that build on the ideological and technological foundations of Web 2.0 and that allow the creation and exchange of user-generated content. Just as the electronic health record serves as a real-time event in recording patient and provider contact, so the use of social media represents an instantaneous form of communication. Healthcare providers, particularly nurses, can enhance the patient care delivery system, promote professional collegiality, and provide timely communication and education regarding health-related matters by using this forum. In all cases, however, nurses must exercise judicious use of social media to protect patients' rights. Nurses must understand their obligation to their chosen profession, particularly as it relates to personal behavior and the perception of their image as portrayed through social media. Above all, nurses must be mindful that once communication is written and posted on the internet, there is no way to retract what was written. It is a permanent record that can be tracked, even if the post is deleted. Social media platforms include such electronic communication outlets as Facebook, Twitter, LinkedIn, and YouTube. Other widely used means of instantaneous communication include wikis, blogs, tweeting, Skype, and the Hangout on Google+. Even as recently as 5 years ago, some of these means of exchanging information were unknown. Another confounding factor is the increased use of mobile devices by health professionals as well as the public. The mobile device, known as the smartphone, has the capability to take still pictures as well as make live recordings. It has found its way into treatment rooms around the globe. As a consequence of more stringent confidentiality laws and more widespread availability and use of social media and mobile media, numerous ethical and legal dilemmas have been posed to nurses. What are not well defined are the expectations of healthcare providers regarding this technology. In some cases, nurses employed in the emergency department setting have been subjected to video and audio recordings by patients and families when they perform procedures and giving care during an emergency room visit. Nurses would be wise to inquire before an incident occurs about the hospital policy regarding audio-video recording by patients and families, as well as the state laws governing two-party consent laws. Such laws require consent of all parties to any recording or eavesdropping activity. Ethical dilemmas arise when moral issues raise questions that cannot be answered with a simple, clearly defined rule, fact, or authoritative view. Moral dilemmas occur when some evidence indicates that an act is morally right and some evidence indicates that the act is morally wrong, yet the evidence on both sides is inconclusive, or an individual believes that on the moral grounds he or she cannot commit an act. Ethical dilemmas arise when moral issues, again, cannot be answered with a simple, clearly defined rule, fact, or authoritative view. Morals refer to social convention about right and wrong human conduct that is so widely shared that it forms a stable, although usually incomplete, communal consensus. Moral dilemmas arise with uncertainty, as is the case when some evidence a person is confronted with indicates an action is morally right, and other evidence indicates that this action is morally wrong. Uncertainty is stressful, and in the face of inconclusive evidence on both sides of the dilemma, causes the person to question what he or she should do. Sometimes the individual concludes that based on his or her moral beliefs, he or she cannot act. Uncertainty also arises from an unanticipated effects or unforeseeable behavioral responses to actions or the lack of action. Adding uncertainty to the situational factors and personal beliefs that must be considered creates a need for an ethical decision-making model to help one choose the best action. The Houston bioethical decision-making model centers on the healthcare professional's implicit agreement with the patient-client. This model is based on 6 contemporary bioethical standards: autonomy, freedom, veracity, privacy, beneficence, and fidelity. Looking at each of these a little more closely, autonomy is the right of individuals to choose for him or herself. Freedom is the ability and right to make choices. Veracity is the right to truth or truthfulness. Privacy is related to personal information and rules that restrict access to this personal information. Beneficence refers to actions performed that contribute to the welfare of others, and fidelity is being faithful to what has been promised. With the knowledge age has come global closeness, or the ability to reach around the globe instantaneously through technology. Language barriers are being broken through technological translators to enhance our interaction and exchange of data and information. Informatics practitioners are bridging continents, and international panels, committees, and organizations are beginning to establish standards and rules for the implementation of informatics. This international perspective must be taken into consideration when informatics dilemmas are examined from an ethical standpoint. It promises to influence the development of ethical approaches that begin to accept that healthcare practitioners are working within international networks and must recognize, respect, and regard the diverse political, social, and human factors within informatics ethics. The ethical approaches can be used to help healthcare professionals make ethical decisions in all areas of practice. Typically, situations are analyzed using our past experience and in collaboration with others. The use of expert systems, decision support tools, evidence-based practice, and artificial intelligence in the care of our patients provides challenges as to who should use these tools, how they are implemented, and how they are tempered with clinical judgment. Typically, situations are analyzed using our past experience and in collaboration with others. The use of expert systems, decision support tools, evidence-based practice, and artificial intelligence in the care of our patients provide challenges as to who should use these tools, how they are implemented, and how they are tempered with clinical judgment. All clinical situations are not the same, and even though the result of interacting with these systems and tools is enhanced information and knowledge, the clinician must weigh this information in light of each patient's unique clinical circumstances, including that individual's beliefs and wishes. Patients are demanding access to quality care and the information necessary to control their lives. Clinicians need to analyze and synthesize the parameters of each distinctive situation using a specific decision-making framework that helps them make the best decisions. Getting it right the first time has tremendous impact on expected patient outcomes. The focus should remain on patient outcomes while the informatic tools available are ethically incorporated. Facing ethical dilemmas on a daily basis and struggling with unique client situations cause many clinicians to question their own actions as well as the actions of their colleagues and patients. One must realize that colleagues and patients may reach very different decisions, but that does not mean anyone is wrong. Instead, all parties reach their ethical decision based on their own review of the situational facts and understanding of ethics. As one deals with diversity among patients, colleagues, and administrators, one must constantly strive to use ethical imagination to reach ethically competent decisions. The goal of any ethical system should be that a rational, justifiable decision was reached. The information concerning an ethical dilemma must remain in the context of the dilemma in order to be useful. Bioinformatics could gather, manipulate, classify, analyze, synthesize, retrieve, and maintain databases related to ethical cases. The effective reasoning applied to various ethical dilemmas and the resulting ethical decisions. This input would certainly be potent, but the resolution of dilemmas cannot be achieved simply by examining relevant cases from a database. Instead, clinicians must assess each situational context and the patient's specific situation and need and make their ethical decisions based on all of the information they have at hand. In order to make ethical decisions about informatics technologies and patients' intimate healthcare data and information, we must be informatics competent. To make ethical decisions about informatics technologies and patients' intimate healthcare data and information, again, this is the provider must be competent in informatics. To the extent that information technology is reshaping healthcare practices or promises to improve patient care, healthcare professionals must be trained and competent in the use of these tools. This competency needs to be evaluated through instruments developed by professional groups or societies. Such assessment will help with consistency and quality. For the healthcare professional to be an effective patient advocate, he or she must understand how information technology affects the patient and the subsequent delivery of care. Information science and its effects on healthcare are both interesting and important. It follows that information technology and its ethical, social, and legal implications should be incorporated into all levels of professional education. Just as we use processes and models to diagnose and treat our patients in practice, we can also apply a model in the analysis and synthesis of ethical dilemmas or cases. The ethical decision-making model follows the line of 7 steps. First, examine the ethical dilemma. Thoroughly comprehend the possible alternatives, hypotheses, ethical arguments, investigate, compare, and evaluate the arguments for each alternative, choose the alternative you would recommend, act on your chosen alternative, and look at where the ethical dilemma and examine the outcomes while reflecting on the ethical decision. When applying the ethical model, examine the ethical, again, you will examine the ethical data, use problem-solving, decision-making, critical thinking skills, collect as much information as possible, making sure to gather relevant facts that clearly identify your dilemma. You should be able to describe the dilemma you are analyzing in detail. The International Council of Nurses Code of Ethics states that the nurse holds in confidence personal information and uses judgment in sharing this information. The expanding use of new information technologies in healthcare will bring about new and challenging ethical issues. Consider that patients and healthcare providers no longer have to be in the same place for a quality interaction. How then does one deal with the licensing issues if electronic consultations take place across state lines? Gerson Miller in 2008 described a second opinion medical consultation on the internet where the information was provided to the referring physician and not to the patient, thus avoiding the licensing issue. Consider also the ethical issues created by genomic databases or by sharing of information in a health information exchange to promote population health. Alpert, 2008, asks, is it wise to put genomic sequence data into an electronic medical record that employs protectors that cannot adhere well to fair information practice principles for privacy and that can potentially be seen by tens of thousands of people or entities when it is clear that we do not understand the functionality of the genome and likely will not for several years. Further, how does one really obtain informed consent for such data collection? When how the data will ultimately be used is not known, but clearly that application will be important to health research uses that go beyond the immediate medical care of the patient. And in 2009 asks whether the public good outweighs individual interests in such a case because the information contained in these databases is important to developing new understandings and creating new knowledge by matching data in aggregated pools. Thus, science adds meaning and context to data, but to what extent do we agree to make that data available such that this discovery process can take place, and are the impacts of discovery great enough to justify the risk? Further, if a voluntary system where patients can opt out of such data collection is adopted, then our healthcare disparities related to incomplete electronic healthcare records created. As science and technology advances and policymakers and healthcare providers continue to shape healthcare practices, including information management, it is paramount that ethical decisions are made. The healthcare professional cannot allow conflicting loyalties to interfere with judicious ethical decision-making. Healthcare professions are typically honest, trustworthy, and ethical, and they understand that they are duty-bound to focus on the needs and rights of their patients. At the same time, their day-to-day work is conducted in a world of changing healthcare landscapes populated by new technologies, diverse patients, various healthcare settings, and changing policies set by their employers, insurance companies, and providers. Healthcare professionals need to juggle all of these balls simultaneously at the same time, a task that often results in far too many gray areas or ethical decision-making dilemmas with no clear, correct course of action. In an ideal world, healthcare professionals must not be affected by conflicting loyalties. Nothing should interfere with judicious, ethical decision-making. As the technology-charged waters of healthcare are navigated, one must hone a solid foundation of ethical decision-making and practice it consistently.